In the fourth section, now we will discuss about the non-functional tumors and GRFomas. In the beginning of the lecture, I said that the neuroendocrine tumors can be the functional, which are associated with more severe symptoms and more severe condition, and the non-functional are also present. So this is non-functional tumors. So we will talk about the non-functional pancreatic neuroendocrine tumors. What are they and what are their features and how we can treat and manage them. Also, what are the GRFomas and also some other rare non-functional, some other rare pancreatic neuroendocrine tumor syndromes. So the non-functional pancreatic neuroendocrine tumors are the tumors that originate in the pancreas and either secrete no products or their products do not cause specific clinical syndromes. Their symptoms are due to tumor mostly. So in the functional, major difference between now we can see the functional tumors and the non-functional. We talked about functional tumors like somatostatinomas, VIPomas, insulinomas, glucagonomas and gastrinomas. All those were functional. The features produced by those type of neuroendocrine tumors were the effects mainly due to excess hormone production by those neuroendocrine tumors. But the non-functional, their symptoms are mainly due to the tumor itself, not the hormones produced by the tumor. They cause secretion of chromogranin A and B, alpha HCG, which is human chorionic gonadotropin, neuron-specific enolase, beta HCG, both alpha and beta HCG, and then the PP or polypeptide. So we have different secretions from the non-functional pancreatic neuroendocrine tumors. Features are the symptoms due to tumor mass mainly. Hepatic metastasis is present with the non-functional tumors. There are large and solitary type of tumors, primarily in pancreatic head. Symptoms are abdominal pain, jaundice, weight loss, fatigue, bleeding. So all these are the symptoms associated with non-functional tumors. They cause jaundice, fatigue, bleeding, and they are more in the pancreatic head. The jaundice, we didn't discuss it with any other functional type of tumor, so it's more with the non-functional because the effects are due to the size of the tumor, due to tumor itself, and this can cause maybe the obstruction of the biliary tree and different effects can produce. So bleeding, fatigue, jaundice, weight loss, and abdominal pain. The diagnosis and treatment is the histological confirmation, positive somatostatin receptor scan, surgical resection, laparoscopic examination or approach, or these are usually the treatments are all controversial. They are not the very reliable treatment options. They are all controversial. But surgical curative resection and laparoscopic approach. GRFomas are neuroendocrine tumors that secrete excessive amount of growth hormone releasing factor that cause acromegaly. Growth hormone releasing factor. So it produce the factor that cause increased secretion of the growth hormone, and that increased growth hormone cause usually two features. One is gigantism, which is increase in the stature, and then the other one is acromegaly, which is increase in the width of the hand and the jaw and the forehead. So acromegaly is due to increased production of growth hormone after the puberty. Once the bones are fused, it causes acromegaly. So this is the neuroendocrine tumor that produces growth hormone releasing factor that can cause acromegaly. Symptoms due to acromegaly or tumor: large and cause liver metastasis. Diagnosis is by plasma assay for growth hormone releasing factor and growth hormone. So diagnosis is by the growth hormone releasing factor and the growth hormone. There is symptoms are due to acromegaly and tumor. That's the picture or the scan of the patient with growth hormone releasing factor tumor. Treatment is by surgery or somatostatin analog. Some other rare pancreatic neuroendocrine tumor syndromes are the Cushing syndrome. Cushing syndrome is also known as ACTH. ACTH is the adrenocorticotropic hormone, and increase in the level of adrenocorticotropic hormone causes Cushing syndrome, with special features of the patient with the Cushing syndrome. Sporadic gastrinomas, we already talked about the gastrinomas. They can also cause paraneoplastic hypercalcemia, renin-producing neuroendocrine tumor, pancreatic neuroendocrine tumor secreting erythropoietin and enteroglucagon, and neurotensinomas. These are all some other rare type of neuroendocrine tumors, pancreatic neuroendocrine tumor syndrome, which are not as common as we said the gastrinomas, insulinomas, somatostatinomas, VIPomas, glucagonomas, which are more common type of the pancreatic neuroendocrine tumors. And then make sure we should know very clearly the difference between the functional and the non-functional pancreatic neuroendocrine tumors. Functional are the one in which the symptoms are produced mainly by the hormone excess. And then non-functional are the one where the features are due to the size of the tumor or by the tumor, not by the hormone excess produced by them. Then we have some other rare neuroendocrine tumors in which we have Cushing syndrome, sporadic gastrinomas, paraneoplastic hypercalcemia, renin-producing neuroendocrine tumors, and neuroendocrine tumors secreting erythropoietin and enteroglucagon, and neurotensinoma, and also we have VIPoma and ghrelin. So all these are the rare type of neuroendocrine tumor syndromes. That was all about the section 4. Thank you for watching sqadia.com.